Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. We're talking some logistics of the vagina on this episode, and you'll see what I mean in a minute, hopefully. Question number 1. I was thinking about getting laser hair removal down there, but I wanted to know if it's both hygienic and safe. People have told me that there are a number of reasons for the pubes being there, and that they help avoid infections. Is it bad to laser them off? So, no. Realistically, it's kind of random why we have hair down there, especially this day and age. Plenty of people groom down there, so if you want to have laser hair removal or waxing, that's totally fine. There really isn't all that much more purpose anymore, especially given that we wear clothing, underwear. There isn't a whole lot of other stuff coming in contact or anything to protect from, so it's absolutely safe and fine. It does take a few rounds of the laser hair removal to really have it completely gone, but if you want to do it, totally fine. Question number 2. At what age do you need a pap smear if you're a virgin? So, technically, in the United States, we say 21, and that may vary in other countries, I'm not entirely sure, but we say 21 in the United States for the first pap smear. The reason that we do pap smears is to check for HPV and cervical cancer. Now, if you're 21 or older and have not had any sort of penetrative vaginal intercourse, it's worth talking to your doctor about, especially if you've had the vaccine and haven't had sex. So the thing to know is that the reason we check for HPV is that most forms of cervical cancer are caused by HPV, and HPV is transmitted through sex. So you would think that if you haven't had sex, you won't be at risk for HPV and you wouldn't need a pap smear. But there are some forms of cervical cancer that aren't linked to HPV, especially if you have a family history of those cancers. And so, again, I would just talk to your doctor about your risks and the benefits and make a mutual decision. Question number 3. I have a white spot on my labia majora. It's not itchy, but it bothers me. I hope it's not serious. Okay, so on the labia majora is going to be sort of on the mons pubis where your pubic hair is. You could still have fortis spots there, which are sweat glands, essentially. They're more common on the labia minora, but they can be on the underside of the labia majora, certainly. It could also be an ingrown hair or cyst. It's tough to say for sure, but if it's not causing any symptoms and you're not worried about a sexually transmitted infection, then you're probably okay to leave it. But you can also show a doctor if you're comfortable, but I wouldn't be too worried about it. I would suspect it's either an ingrown hair follicle or a cyst, or a fortis spot, which is a sweat gland. Question number 4. I masturbate, and it used to feel amazing. I'm now 20 years old, and lately it has been hurting, feeling uncomfortable, and I'm not very wet. It's been happening for about 4 or 5 months, and I still have a high sex drive. Do you think I need to get this checked out? Every time I look stuff up on Google, I never get the answers I need. It's usually an STI, etc., and I don't think I have any of that. Help. Okay. So I would have just a couple other questions for you. Specifically, have you had any medication changes like birth control? Birth control can contribute to changes in your vaginal moisture. And so if that's the case, I might talk to you about either lubrication, if you like that birth control, or trying a different form of birth control, or a birth control with different hormone formulations. And then I would say, if you're sure you don't have an STI, it's still worth talking to a doctor about, because there are some conditions that can cause some pressure down there, like endometriosis, and that's worth talking to a doctor about for sure. Question number 5. I have an IUD and I recently had sex. My periods are irregular, so I never know when I'm ovulating, but I think it might be right now, so I took a Plan B 10 minutes after sex. What's my risk of pregnancy? So the IUD is actually fabulous at preventing pregnancy. The hormonal IUD, the pregnancy rate is something like 0.2%. So just being on the IUD is a great form of birth control, so you really shouldn't have to worry about pregnancy. That being said, if you took a Plan B, you're you should be totally covered in case you were ovulating. But the chance of pregnancy with an IUD alone is very low, plus Plan B, which stops or prevents ovulation, you should be pretty well covered. And that does it for this round of some vaginal logistic questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.